All right, everybody, welcome back to another episode of Word with Ty Brownlow. I am your host, Ty Brownlow. Remember, no one is worthless. No story is worthless. Today, ladies and gentlemen, y'all know I got to bring it home. The home team, Chicago, Illinois. And my guest today is the CEO, y'all know about the CEO life, okay? CEO and medical director of HFit Health. Please put your hands together for Mr. No, I take that back. Dr. Anthony Harris. All right, come on now. All right, doctor in the house. Okay, man, you better not let me get that wrong. Come on. How are you?
Thanks so much, man. This is great to be on. Great having me, and let's do this. Yeah, for sure.
All right. Now, as I said before, CEO and medical director of HFit Health. And today, ladies and gentlemen, we're going to talk about workplace safety during COVID and how metropolitan cities can keep kids, schools, and restaurants open during these times. So my first question to you would be, tell us a little bit more about HFit Health and who do you serve and what is it that you all do?
Sure. So again, thanks for having me, Ty. This is a phenomenal opportunity to talk about obviously something that's on the minds of every person in America and beyond, right? And so, when we're talking about what HFit Health does, we're bread and butter, what's called Occupational and Environmental Medicine. That's my board certification as a physician. Been practicing for a decade. We've been around for a couple years. We've been doing, COVID since COVID began in terms of helping large organizations and small stay safe and keep their workers, one, in the workplace safely, and two, home safe when they have been exposed or affected by COVID, right? And then we get you back to work quickly as possible, but safely as possible too. I mean, you name it, we've seen it, we've done it. We've done over 10 million COVID screens nationwide, internationally as well, with the programs that we've been doing. So it's all about keeping our workforce healthy, keeping our communities healthy. Preventative health is my focus, and that's what we're all about.
Preventative health? Come on, look here. Preventative health plus informational content. That's what this show is about, ladies and gentlemen. I'm trying to tell you. Look, I'm going to bring them on here to drop these jewels. Y'all better pick them up. I don't know what else to tell you, okay? Look, that's just what we do around here, all right? I love it. I love it. And see, what I love even more is you're doing it on a local, countrywide, and international level. So not only are you learning about what's going on here on a national level, but pretty much across the seas and other countries as well. So I think that perspective is very, very key and, help fight everything. So that's what's up. Okay, hats off to you, sir. Now, my next question to you would be, how can businesses safely stay open during these Omicron surges?
Absolutely. And, you touched on some things that are super important, right? The global perspective is what we have to lead in with, because we know if you look at not just CDC, but WHO leadership, that we're going to be dealing with COVID for at least 2 to 3 more years. I know it's been a long time. It's been since 2020, right? End of 2019. But again, 5 years was the estimate when this all first started. And that's what it's still looking like at a minimum that we'll be dealing with COVID. And it's because this global population of people are still susceptible to COVID. Obviously, we're pushing the vaccines, we're pushing safety. And so to jump into what we need to do in the workplace to stay safe, first and foremost, if you do nothing else, wear masks. I know it sounds like a beaten drum. We've talked about that since day one of this pandemic, but by far and away, we know that if we all mask up in the workplace, we're going to reduce transmissions. And it doesn't matter if it's Delta or Lambda, Mu, all of these different variants, or Omicron. We know that masking plays a key role in helping prevent respiratory droplets from spreading from one person to the next. Look, the statistics before COVID are solid. 94% of workers admit to showing up to work sick, right? 94%. right? So imagine that obviously now during COVID where workers are showing up, they have the sniffles, don't think much of it. No, it's not COVID, just a head cold. But that's how Omicron in particular is presenting with many people. So we know that, again, number one, wear masks. Number two, stay home if you're ill, right? If you're having any symptoms whatsoever, this is what we have been helping with when I mentioned those health screens on a digital platform nationwide, internationally. It's if you have symptoms whatsoever, stay home, right? And get that evaluated right away to determine, are you high risk, medium risk, or low risk for COVID? And that process works well. This is all part of an umbrella we call COVID clear zone philosophy, how to keep COVID out of the workplace and keep your workers in the workplace safely. So that's number two, staying home if you're feeling any symptoms and doing it on a daily basis, right? Number three is the things we've been talking about for some time: social distancing, right? If you can, good hand hygiene, using that alcohol, right, on the hands, washing the hands frequently, with regard to surfaces and things like that. That's going to be key from now until, right? Studies have shown, again, pre-COVID, that if you provide or have access to good hand hygiene in the workplace, you can reduce transmission of not just COVID, but the cold or the flu by 80%, right? And so that is instrumental in terms of staying with us beyond COVID to help keep the workforce healthy and working. So that's number three. Number four, you all know what I'm going to say next. Let's get vaccinated, y'all. I mean, we gotta step it up. We have to not only get vaccinated, but get fully boosted as well. Why? First and foremost, let's protect ourselves. Let's protect our loved ones from severe illness and death. And vaccination is the way to do that. And yes, I know what y'all going to say next. We can still catch Omicron even if we're vaccinated. The answer to that is yes, right? But the studies are solid in terms of the protective factor that you get from being boosted after being fully vaccinated, going back up into the 93% percentile of protection. Certainly against hospitalization severity, we're talking orders of magnitude better than if you're unvaccinated in terms of dealing with COVID. So those are the four pillars that I wanted to mention in terms of how to keep the workforce safe. There's some other measures that the workforce can take, the workplace can take, with HVAC systems and how much air is moving through the exchange and all that. But we'll leave it at those four pillars for right now.
Okay, look, now let me just say, you didn't drop a lot on us, but let me just say as well, it is information that we've heard before, and I'm just gonna say it, and I know y'all, this is probably unpopular opinion, like, Ty, why are you doing this? Don't worry about it. Look, we're about saving lives. We're about keeping people around, and instead of 6 feet underground. Okay, we're about keeping them here with us. Okay, so those like KN95 mask or what have you, if you have a chance to get those. Okay, it's to the point now where they're even shipping these out to homes. Okay, they're shipping out the home COVID tests to homes as well. Sign up for these things. These things are free of charge. Don't get me wrong, cloth masks are cool. They're all right. I mean, hey, you may have the ones with the little rhinestones and sprinkly this, that, or whatever on it. But look, let me tell you, if you can blow out a candle in the mask, chances are you can also catch Omicron and COVID wearing the mask as well. So we want as much protection as possible, and surgical masks, N95, KN95 masks, those are proven to work even more, Now, one question I will ask you about the booster, so if a person were to get if a person were to get vaccinated at the beginning of the year, how much time would you say before they were to get their booster?
Sure. So if you got, your full series, one shot of the Johnson & Johnson or 2 doses of the Moderna or the Pfizer vaccine, you have about 6 months before you need that booster. And the data behind that the best data that I like to look at comes out of Israel. And they were one of the fastest countries to get the most people vaccinated. They all used the mRNA Pfizer vaccine. And in that process of looking at how did their population fare over time against COVID, after being vaccinated. I mean, we're talking almost 70% of the country was vaccinated months and months ago, last year. They found that about after 6 months, your protective factor went from high 80s and 90s all the way down to about 37%, right? And so that's why we need that booster to get that back up into the 90s in terms of protecting us from symptomatic illness from COVID. And it works. We've seen it play out here in the US and abroad, and that's why we're still promoting vaccination and booster when it's time.
Okay. All right. Hey, come on now. All right. Look, we're trying to save lives around here, people. Okay. All right. I told y'all, informational content. That's what you're going to get over here. All right. So my next question would be, when it comes to safety measures, what advice, can you give large companies to avoid, to stop the spread of COVID amongst, the employees?
Sure. So we've seen some companies do well, and we've seen companies not do so well, right? And some of the things that has been ignored that we know can be protective is putting up physical barriers, right, between workers. If you're in a large factory, right, that means putting up shields. Oftentimes, a barrier between a worker that's standing shoulder to shoulder or elbow to elbow with another worker is all you need to help decrease your exposure from one worker to the other. And ignoring that factor can have devastating effects. We saw early on in the pandemic. I was personally involved with helping an organization in Texas, in the meat industry, that had 60% of their workforce positive for COVID at one given time, right? And so, again, not having these measures in place can have devastating effects on the workforce. And so, the second thing is ignoring the opportunity to keep people protected from enforcing masks. We know some companies say, you know what, that mask's not a big deal. We just talked about it. And so we know that avoiding the requirement of masks in the workplace is not a good look in terms of preventing illness transmissions in the workplace. And then one of the other things that you should absolutely not do for your workforce is put the fear of God in them that if they stay home sick, they're going to be terminated, right? We've seen that. Y'all know that's real, right? Where your supervisor will tell you, I wish you would, stay home from work tomorrow, right? And we know that in that stressful environment of fearfulness of losing your position, your job, people show up to work sick with all kind of, not just COVID, but flu and other illnesses, putting everyone else at risk. So again, not having the right culture in the workplace around the safe protective barrier of stay home if you're sick, right, as the messaging, can have devastating effects on the workforce as well.
Now, look, let me just speak from a mental health standpoint, because I prided my platform on talking about mental health for the rest of this year. From that standpoint, there's a lot of anxiety, that goes into that as well. Because if you're being, first and foremost, if your livelihood is being threatened, and they're telling you, hey, you better not stay home. I don't care if you are sick, this, that, or what have you. And hey, I don't want to go and I don't want to be responsible for getting others sick at the job or spreading this or what have you. And my livelihood's being threatened, so now I'm sort of stuck. I'm sort of forced to do this. That can linger. That can drive a wedge between you, your job, and other things as well that's going on in your life. And there's really no need for that at this point in time. If the goal is for us to be secure and safe, then by all means, let us be secure and safe. And once you follow the certain protocols to get, well enough to come back and to actually work, I feel you should be granted, access to come back to work, because you're being productive now. How productive can you really be at a job knowing that you're here, you're sick, and you're possibly spreading and getting others affected like that? I don't know about anyone else, but that doesn't sound like a very productive workforce to me. So, and on top of that, I'm gonna say this to you. Look, and I'm telling on you, Florida, and I'm telling on you, Las Vegas. Okay, I'm telling on y'all. All right, I'm telling on you, especially Jacksonville. I'm telling on y'all. So, look, Dr. Harris, my wife and I took a trip. We took a trip down to Jacksonville, and let me just say, we were the only ones wearing the mask in a lot of different places. And the looks we got.
Yes.
I can't even tell you, I can't even describe, I wouldn't even call it racial. It was just like, look here, I'm from another planet. You know what I'm saying? I'm not even going to say it was racial. It was like, look, you ain't even human. You from another planet. Why are you doing that? And my question was, why aren't you all doing what needs to be done? And especially a place like Las Vegas, which I was highly upset. I thought that people would take especially since it's so close to California, and you find out about all the high numbers or what have you coming out of California. It was very disheartening. That's all I have to say. That was very disheartening.
Well, I feel you on that one. I'm a Florida native myself. Grew up in Florida. My folks are still down there. And every time we go down to visit, we take the family. My 4-year-old's walking around with her mask on, looking like, what's going on? Why that 4-year-old don't have a mask on? Why they mom and daddy don't have a mask on? So I totally understand the looks that you are referring to, my friend, because I've been on the receiving end of them looks as well, for sure.
Okay, so look, I'm sorry, y'all. I don't want to be a tattletale. I don't want to be a snitch, but I'm telling on you, Florida, and I'm telling on you, Vegas. Okay, I'm telling on y'all. All right, stop it. Okay, so now let's just stay a little bit in this vein real quick, because I want to hear your thoughts about CDC guidelines and recommendations as far as vaccinations and quarantine protocols. Now, there are skeptics out here. Of course, there have been skeptics from day one. Science is science, people. Okay, it's science. It's science. Okay, it's science. Okay, let's just stop there. It's science. But you have skeptics out here who they are leery of getting the vaccine. And then when it comes to quarantine protocols, you may hear the CDC. At first it was 2 weeks, then it was 10 days, now it's 5 days. And in certain people's minds, they're like, well, man, if they keep switching this around, how do we really know what's right? So if they do this, then that must mean, the vaccination must not really work, and how can it? So you have skeptics all around, okay? But what are your thoughts when it comes to these CDC guidelines?
Sure. It's evolving. I refer to, what has happened with CDC and the recommendations that have come out, akin to what we do in healthcare and in medicine, right? As the practicing physician, you're not going to walk into my office and I explain to you, what may be going on and tell you 100%, this is what's happening, right? This is your diagnosis 100%. Nothing's 100% in the practice of medicine. That's why it's called the practice of medicine, right? But we can tell you, hey, based upon what we're seeing, based upon what we're finding with you in particular, this is what we believe to be going on with a high likelihood, right? That's how we communicate, disease and diagnosis and treatment, right? And CDC is no different. So we follow the science as it has evolved with the different lineages and variants that have cropped up. We know, for example, that Omicron does in fact cause less severity in the majority of people than Delta did, for example, than the wild type original coronavirus, Alpha, right, and Beta. So we know this because we've looked at the data as it's unfolded. And so as a result, we now have, in addition to the market pressures, I'm gonna put on my M.B.A. hat now, right, my Keynesian economist hat, and we're talking about how the economics of where we're at and the jobs that are no longer being filled because there's no people to fill them because everyone is out sick, right? That has caused this economic pressure in the nation that CDC has appropriately, from a balancing of risk versus benefit, said, look, you can go back to work in 5 days if you meet this criteria because your risk of spreading the virus to someone else is low at this point in time, right? And so that's why it's 5 days versus the 10-day isolation period of old, or quarantine period, versus the 14 days. It went from 14 to 10 to 8, now to, but at each step of the way, the balance of, is it worth it, right? Is it beneficial for us to get people back sooner in this state versus the outcome of potentially spreading the illness to others. And so now that's where we're at in terms of the right balance. Now, does it mean that if you're vaccinated and you're symptomatic after an exposure, you don't have to stay home? No, it doesn't mean that, right? The latest recommendations are only if you are vaccinated and exposed without symptoms can you stay at work, right? In the workplace. Now, while you're there, you got to mask up, right? You get a test on day 5, which is recommended by CDC. And if it's negative, then you're good. You continue to, continue forward wearing your mask for a full 10 days. If it's positive, obviously you're isolating because now you're positive for COVID for the prerequisite amount of time, which is still 10 days. If you're positive with COVID, you're symptomatic, more than likely you're going to be out for 10 days. Now, can you come back sooner if your symptoms are improving and you have a negative test in most circumstances? The answer is yes. But that's a decision that CDC says that's left up to your physician, your doctor, so that you have the right guidance in terms of when to get back to work the soonest and the safest, right? And so it's going to evolve. We'll see something different. Now, if we, this IHU variant that came out of Southern France, if it crops up more in different nations and it becomes a variant of concern, VOC by WHO, we may see new recommendations come about if the severity of this particular variant is more than Omicron, right? We may see backtracking to 8 days or longer. It's all about looking at what are we dealing with today? How do we deploy a systematic approach to keep the majority of people safe, but to keep the lights on at the business too, right? If the lights go out, we all are in trouble nationwide. And so that's why we have to strike that balance with the changes that people have seen. At the end of the day, also, getting the vaccine, it's clear the risks outweigh the benefits, don't outweigh the benefits, right? So getting the vaccine is going to benefit you so more. It basically is going to stop you from dying from COVID, right? Now, I said it ain't nothing 100%. But again, 95%, 95% effectiveness at preventing death and severity is what the vaccine with boosting affords people. And so that in and of itself is a reason to get vaccinated. And we know there are some small risk side effects to the vaccine. That's inescapable. You take too much Tylenol, guess what? Side effects. Too much ibuprofen, guess what? Side effects. You eat too much greens, you're going to have side effects, right? I know I have side effects with broccoli myself. But all I'm saying is that we know there's risks and benefits to everything we do in healthcare. And at this point in time, it's clear the benefits of getting vaccinated far exceed the risks of any side effect. The biggest risk of COVID, we know, is death. And there's other risks, erectile dysfunction, cardiac disease, stroke. All those are risks of getting COVID. The brain fog that can last for months and months. We know effects of COVID. And if you're vaccinated, those effects become less risky.
And hey, look, let's just not talk about, the after effects, like the breathing and, the just fatigue, as you said, mental and physical fatigue, like these things can happen if you're not properly vaccinated. And I'll even take a step further, getting boosted, So look, at the end of the day, people, just because, and we're going to go into this a little bit, even for my people who have had, their, vaccinations and their boosters, you still have to follow the guidelines. And, I'm just going to go right into it because I mentor youth as well as young adults. And some of the youth that I mentor, that are in high school, I hear them all the time, these kids, they don't want to put on the mask and, they want to say that I'm vaccinated, I don't need to wear a mask. But you still need to follow these guidelines. Look, I understand. Youth are youth. Sometimes they can be very rambunctious. They think, hey, you know what? I'm young. I can cheat anything. I'm not worried about this. I'm not worried about that. But these are very critical times, people. We need to be as mindful as possible about everything that we do. And on that note, I'm going to go into this question. Man, speaking of schools and, places that are, very essential, how can we protect ourselves and the people around us from getting COVID in the workplace and these schools as well?
You bet. Particularly, let's focus it in on the schools because Lord knows, we in Chicago with our public school system have been in a pinch, right? Particularly with those schools that have been historically under-resourced. And we want to keep kids at school. The benefits are clear in terms of that social interaction engagement, in addition to getting their lessons, right? And so the number one approach, besides, in addition to the things we've already mentioned, the mask and the social distancing as possible, the hand hygiene, etc., is testing, right? Access to testing and testing frequently is going to be key. This data comes out of the Columbia University last year, definitively show that the more frequent you test in a given population, whether it be a school population or a workforce, the less likely you are to have workplace or school place COVID transmissions or illness, right? And so it showed and demonstrated that testing once a week does have a positive effect on the population in terms of prevention. If you test 3 times a week, like the TV and movie industry does for their workforce, the actors and the all the folks behind scenes, it's very effective. If you test every day, that's the most effective. Obviously, there's resource constraints to prevent. I don't know, but one institution that we worked with throughout the pandemic that's been able to do daily tests, right? But in general, testing is going to be the way we can limit the spread of COVID in the workplace or the school and keep people functioning in their normal capacities, enjoying their normal activities as much as possible during this pandemic.
Now, look, let me just say this. You are correct. Daily testing, if you can, if your place of business or your school offers that, great. I am all for it. And I think everyone should be tested. Not just those who, are unvaccinated but get tested weekly, but everyone should be tested, because we just want to put a cap on it as much as possible to keep it down, and to prevent spreading, But I will say this, and I would love to hear your thoughts on this, but for all of, those people that I know, you know what, I don't know what the term is, but for those of us out there that, hey, you know what, I eat well, I have a healthy lifestyle, I work out, I make sure I'm, this, that, and the other. You're doing everything else but getting vaccinated. You can still spread, the Omicron and coronavirus as well. So just because you may live a certain type of lifestyle doesn't mean you're immune to getting it at all as well. And I'm going to say this as well. If you are vaccinated and boosted, but you're still out here living reckless, maybe you should take on some of that lifestyle that some of these other purists are. You know what? I'm going to call them purists. Yeah. So maybe you should take on the lifestyle that some of these purists are out here doing as well, and, protect yourself so you can protect your family, so you can be around, eat better, wash those hands. Okay, look, wash those hands, wash those clothes, change the mask. If you're wearing gloves, change your gloves. Whatever you think is highly impossible to do, do it. Like if you think it's like, hey, you know what, this is too much, it's not too much, because we're talking about safety, we're talking about your health. Okay, so on that note,
love that.
On that note, sir. If people want to get in contact with you, if they want to learn more about, HFit Health or what have you, how can they get in contact with you, either social media or website?
Yeah, they can hit me up on my Twitter, Dr. Anthony Harris, at Dr. Anthony Harris. They can hit me up on any of our branded websites, HFit websites. You can go to hfithealth.com. It'll tell you all about us, who we are. You got my picture on there with a little profile and everything. Or you can Google Anthony Harris, MD, and you'll see me on Fox News, CNBC, Bloomberg Radio. Hey, we're out there trying to spread the word, trying to, help prevent as many cases of COVID and transmissions and keeping the workforce safe, for sure.
Okay, home team telling y'all this good business. Okay, look, people, informational content. That's what I pride myself on giving you all, and who better than a doctor? Okay, I don't know. So you tell me. But science, people, science. It's called science for a reason. Okay, so I'm just gonna say it. Science. That's it. That's all. All right. Now, this brings me to the last question, but the question that my show is known for, so I'm going to present it to you, good sir. Dr. Anthony Harris, what is the one word that best describes you and why?
Enthusiastic. Enthusiastic. Because that's my approach to almost everything in life, right? I can summarize it in a poem. One of my favorite, it's a quote, rather. A quote from 1936 by Lawrence Pascal Jacks. He wrote a book called Education Through Recreation. And it pretty much summarizes me and my philosophy in life. It says, a master in the art of living draws no sharp distinction between his work and his play, his labor and his leisure, his mind and his body, his education and his recreation. He hardly knows which is which. He only pursues his vision of excellence in whichever he's doing and leaves it to others to decide whether he's working or playing. To himself, he always seems to be doing both, enough for him that he does it well. So that's me, and so I approach every day with enthusiasm, and I'm blessed to, wake up in the morning, blessed to have wife, 2 kids, and to be living my passion, right? To be helping others and doing exactly what God put me here to do. So I'm enthusiastic about life.
Look, if I had a microphone right now, I would drop it. I don't, but that's okay. Let me just say, he gets the distinguished. All right, look, I'm telling y'all, dropping them jewels for you. Look, people, I don't know what else to tell you. Look.
Awesome. Much appreciated, my friend.
Brother, look here. Look. Home team, okay? Look, they from Chicago. I'm going to get them on this show, okay? If they're anywhere here, I'm going to get them on. Yeah. Let me just tell you, I wholeheartedly appreciate you coming onto the platform, dropping these lessons for us, dropping these jewels. Some people may say gospel or what have you. Whatever, I'm going to take it all.
Yeah.
Brother, I am thankful for you, okay? Thank you. Man, okay? Thank you. Man.
Hey, I'm grateful for the opportunity, my friend. This has been a blessing, and you're doing strong work, man. You're doing the work, and you're helping out so many. So, this is super important, and really grateful for the opportunity to share in this and your efforts to help protect so many.
The pleasure is all mine, and I'm just going to tell you, you family now. You've been on the show, you're on the platform, you family now. So, as family, the doors are open whenever you want to come back and talk to us again. Look,
awesome.
And you home team, so you already know. Look here now, you can come on back on here. Whatever you got going on, I'm pretty sure that myself and all my listeners and all the listeners that we're going to gain will be more than happy to hear what you have to say. And on that note, ladies and gentlemen, this has been Word with Ty Brownlow. I've been your host, Ty Brownlow. Remember, no one is worthless. No story is worthless. Follow me, all social media platforms at Word with Ty Brownlow. Or you can go to my website, tybrownlow.com. Get this wonderful, important, informative conversation, plus other great interviews as well. Dr. Anthony Harris, home team. Appreciate you, brother. We out, y'all. Peace.